Hi, I'm Dr. Matthew Weiner from the Pound to Cure Weight Loss Center in Tucson, Arizona, and today I'm going to talk to you about what your options are when you're facing a Wegovy shortage. Now, Wegovy is also known as semaglutide. It's a weight loss medication in the GLP-1 class, and it's really a game changer when it comes to the medical or non-surgical treatment of weight loss. We'll see around 15% total body weight loss with Wegovy. The big problem is it's been almost impossible to find for these introductory doses. Patients who are on the higher doses and have been on it for a longer time are able to typically find those doses, but those introductory doses are very difficult. So you've got a couple of different options. If you go to the pharmacy after you've gotten your prescription and the pharmacist tells you, sorry, we don't have any, it's on back order, we don't know when we're going to get any in. Well, your first option is to wait and really focus on nutrition. So this is a lifelong journey you're going to be on, and nutrition is going to be a critical piece of this puzzle. And so getting started on your nutrition program while we wait for the Wegovy to come in is a very reasonable option. You're not going to see as much weight loss as you will once we get you on the medication, but it's still a pretty decent option. And we have a great nutrition program with specific support groups that are focused on patients on GLP-1 medications and what you can do to maximize weight loss and minimize side effects. The second option is switch medication. There are other medications, and depending on what your insurance coverage is, you could switch to Ozempic, which is a diabetes version. There may be a pathway for you to get insurance coverage for that, or even Mounjaro, which is in the same class and maybe even a little more effective when it comes to weight loss, or Saxenda, which is a less effective option that is also prescribed for weight loss and is very reasonable. Another is to change dose. So if you are really close to going up to that next dose, we typically see at the 1 milligram mark, that's when Wegovy becomes a little easier to find. And so going up on the dose may be a reasonable option as well. You may also want to try different pharmacies. And what we have our patients do, we give them a paper copy of the script that still works and they can take it around. The problem is they ask me, well, what pharmacy is going to have it? I can't tell you that, because whatever pharmacy has it today is not going to have it tomorrow. That's how this is working. And so you really have to shop it around, be ready to go, be ready to bring your prescription over and get it filled as quickly as possible. And most likely your physician office isn't going to be able to help you with this. None of us have any answers on this either. This is a supply chain issue that is far beyond our scope of being able to influence. And I think the final option, and it's one I always make with a little bit of trepidation, is you can get your prescriber to prescribe one of the higher doses, and there are some ways that you can dilute the medication and use it at those lower doses. And that really requires some medical expertise. So in my practice, I really only offer this option in someone who's a nurse or a pharmacist or has some medical training and is comfortable with diluting and drawing up syringes and things like that. But that is an option if you're looking for a solution to get on Wegovy before you're able to access the lower doses because of a shortage. So I hope those 4 options were helpful. You can check out our website and upcoming videos we've got on GLP-1 medications and weight loss.